Imagine waking up one day and realizing that your body is trying to warn you about something serious, but you don't know how to interpret these signs. In today's video, we'll reveal 7 critical signs that your heart might be in danger and could be fatal if ignored. These signs are like silent alarms that can be easily overlooked, but might be urgently calling for help. If you've noticed something strange or are worried about your health, this video is for you. We'll explore each of these signs and show you how to identify them to take preventive actions. Don't put off what could save your life today. Watch now and learn how to protect your heart before it's too late. First sign, Frank's sign, the diagonal fold on the earlobe that could indicate heart problems. Imagine your body as a silent messenger, always trying to communicate with you. Sometimes, it sends us small signs when something isn't quite right. One of these signs is known as Frank's sign, and it appears in a peculiar way on the earlobe. Let's explore this a bit more. Frank's sign is a diagonal line that can appear on the earlobe, like a small fold that cuts from top to bottom. At first glance, it might seem like a minor detail, almost like an odd mark. However, this small fold could be an important warning about your heart health. Think of your heart and arteries as a system of roads and vehicles. The arteries are the roads that carry blood from the heart to all parts of the body. When these roads start to become obstructed by fat plaques, it's like there's a traffic jam. The blood has a harder time moving along, and the heart has to work harder to push the blood through the narrowed arteries. This extra effort can lead to more serious problems, such as heart attacks and other complications. Here's the crucial part. If you or someone you know notices a diagonal fold on the earlobe, it might be a sign that it's time to pay more attention to heart health. There's no need to panic immediately, but it's a good reason to schedule a doctor's appointment. The doctor can perform detailed tests to check for issues with the arteries or heart. This way, any risks can be identified, and steps can be taken to care for cardiovascular health. This story reminds us that the body has subtle ways of communicating when something is wrong. Frank's sign is an example of how small signs can indicate deeper issues. By paying attention to these signs and seeking medical help when needed, we can better care for our health and ensure our hearts stay strong and healthy. Recognizing and acting on these signs allows you to take proactive steps to protect your well-being and prevent more serious problems in the future. Second sign, loss of hair on the legs, a sign of peripheral arterial disease. Hair loss on the legs can be an important sign of circulation problems. When hair starts to disappear, it could indicate that blood flow to the area is compromised. One of the issues associated with this symptom is peripheral arterial disease. Peripheral arterial disease is a condition where the arteries that carry blood to the legs become obstructed by fat plaques and other deposits. These obstructions restrict blood flow, which can negatively impact leg health. With less blood flowing to the area, tissues and hair follicles do not receive the necessary nutrients and oxygen needed to maintain hair growth and health. The reduced blood flow due to arterial obstruction can lead to a range of problems. Hair follicles, which are responsible for hair growth, can become weakened and eventually stop functioning properly. This results in hair loss on the legs, which can be one of the first visible signs that something is wrong with blood circulation. If you notice hair loss on your legs, it's crucial to seek a medical evaluation. The doctor can conduct specific tests to assess the condition of your arteries and check for obstructions affecting blood flow. Based on the results, the doctor may recommend treatments to improve circulation and address peripheral arterial disease. Ignoring signs like hair loss on the legs can lead to more severe health issues. Identifying and treating peripheral arterial disease early is crucial to prevent additional complications, such as leg pain, ulcers, and in severe cases, even amputation. Therefore, it's important to be attentive to these signs and seek medical help to ensure good circulatory health and maintain quality of life. Before we move on to the next sign, have you checked if you're subscribed? We'll be bringing daily content like this. Third sign, xanthelasma on the eyelids, the yellow sign from your body. Imagine your body as a control panel that lights up warning signals when something isn't functioning properly. Each light has a special meaning and alerts us to what we need to pay attention to. One of these signals is xanthelasma, which appears as yellowish deposits on the upper eyelids. Think of xanthelasma as a small warning your body is trying to give you. These yellow deposits may seem harmless and are often just an aesthetic detail. However, they are trying to tell you something more important. There might be a problem with your cholesterol levels. It's as if xanthelasma were little warning lights blinking to draw your attention to a deeper issue. When blood cholesterol levels are high, it can accumulate in various parts of the body, and one place it may manifest is around the eyes, forming these yellowish spots. It's like cholesterol is making a pit stop on the eyelids before moving to other areas, such as the arteries, where it might start causing more serious problems. These deposits are a sign that you might be at risk of heart disease. High cholesterol can lead to the buildup of plaques in the arteries, which can eventually result in issues like heart attacks and strokes. So, when you see xanthelasma, your body is saying, "Hey, look at me. We need to do something about this." If you start noticing these yellowish deposits on your eyelids, it's essential to act quickly. Schedule an appointment with your doctor. The doctor can perform tests to measure your cholesterol levels and assess your risk of heart disease. From there, you can receive guidance on dietary changes, medications, or other measures to control cholesterol and protect your heart health. Remember, xanthelasma is more than just a physical characteristic. It's a reminder that your body is telling you something important. Paying attention to these signs and seeking medical help is a proactive way to take care of your health and ensure your heart stays strong and healthy. Fourth sign, arcus senilis, what it can reveal about your health. Arcus senilis is a white or gray ring that can appear around the cornea of the eyes, usually associated with aging. This ring is quite common in older individuals and is often seen as a natural part of the aging process. However, when this ring appears in younger individuals, it could be a sign that something more significant is happening in the body, especially related to lipid levels. Imagine arcus senilis as a frame that starts to form around the iris of the eyes over time. In older people, the presence of this ring may simply reflect natural changes in the eye structure as age progresses. But when this ring appears in someone younger, it may be a sign that there is an underlying problem. This ring is made up of lipid deposits, or fats, that accumulate in the cornea. In young people, this buildup may suggest lipid disorders, such as high cholesterol levels or other metabolic issues. The fact that the body is accumulating these deposits in the cornea might indicate it's struggling to manage excess fats in the blood, which in turn could increase the risk of cardiovascular diseases. If you notice a white or gray ring around the cornea, and especially if you are young, it is wise to seek a detailed evaluation from a doctor. The doctor can conduct a series of tests to check your lipid levels and identify possible metabolic disorders. Based on the test results, the doctor may recommend dietary changes, increased physical activity, or medications to help manage cholesterol levels and protect your overall health. Don't ignore arcus senilis, especially when it appears in younger people. This sign can be an important clue that your body needs medical attention. By seeking help early and following your doctor's recommendations, you can take proactive steps to prevent more significant problems and ensure your eye and cardiovascular health remain in good condition. Let us know in the comments if you knew about this, and if there's anything you think we missed in the video, share it with us. Fifth sign, cyanosis, what your skin might be trying to tell you. Cyanosis is a condition where the skin takes on a bluish or purplish color, especially noticeable on the lips or extremities like hands and feet. This phenomenon is not just a color change, but an important sign that something might be wrong with the amount of oxygen reaching your tissues. When the skin starts to turn blue or purple, it indicates that oxygen levels in the blood are lower than they should be. This can occur for various reasons, and it's crucial to pay attention to these signs to identify and treat potential health problems. Cyanosis can be caused by respiratory issues, such as lung problems affecting the ability to absorb oxygen from the air. It may also be related to heart problems, where the heart is not pumping blood effectively to the lungs and the rest of the body. In both cases, a lack of oxygen can lead to severe symptoms and require immediate medical attention. If you or someone you know begins to show a bluish or purplish color on the skin, especially around the lips or extremities, it is important not to ignore this sign. Seek medical attention as soon as possible. A healthcare professional can perform tests to determine the underlying cause of cyanosis and provide appropriate treatment. Treatment may vary depending on the cause. It could involve administering oxygen to help increase blood oxygen levels, medications to address heart or lung issues, or other specific interventions based on the diagnosis. Remembering that cyanosis is a serious sign is crucial for ensuring health and well-being. Acting quickly when noticing these signs can be key to avoiding more severe complications and ensuring you receive the necessary treatment to restore healthy oxygen levels in your body. Before we continue, I noticed you haven't left a like yet. Let's proceed with more important information. Sixth sign: leg ulcers. What they can reveal about your circulation. Imagine your legs as part of an extensive network of highways, where constant and efficient blood flow is crucial to keep everything working well. If a section of these roads begins to show problems, like potholes and blockages, it can cause a serious traffic jam affecting the flow. Similarly, persistent leg ulcers can be a sign that blood flow is compromised and something is wrong with the body's internal roads. When you notice ulcers on your legs that don't heal or seem to always be there, it's like seeing cracks in a road that aren't being repaired. This issue may indicate that the blood, which should provide oxygen and nutrients to keep the skin healthy, isn't reaching the area as it should. Just as a damaged road can lead to accidents and further deterioration, inadequate circulation can worsen the ulcers and make the situation even more serious. These ulcers can arise for various reasons, including vascular diseases or vein problems that hinder blood flow. Without efficient blood flow, the skin tissue begins to deteriorate, and ulcers can form. These wounds can be a breeding ground for infections and other serious issues, potentially leading to more severe complications if not treated. Imagine you're walking on a road that starts to show more potholes and cracks. Without proper maintenance, the road can become increasingly dangerous and difficult to traverse. Similarly, if ulcers are left untreated, they can worsen, leading to infections and greater damage to the tissues. Early treatment is essential to prevent these complications and restore the health of your skin. If you notice persistent ulcers on your legs, it's important to seek medical help. Don't ignore these signs, as they can indicate serious problems with blood circulation. The doctor can perform tests to evaluate blood flow and identify the cause of the ulcers. Based on the results, treatment may range from lifestyle and dietary changes to using compression stockings or medical procedures to improve circulation. Paying attention to your body's signals and seeking medical guidance when necessary is essential for maintaining leg health and avoiding more serious problems. By acting quickly and following medical recommendations, you help heal the ulcers and protect the overall health of your legs, ensuring that your internal roads remain in good condition and allowing you to continue moving through life with ease. Seventh sign: swelling in the legs. What it might reveal about your heart. Swelling in the legs or ankles can be an important sign of heart failure. When the heart is unable to pump blood efficiently, blood can accumulate in the veins, especially in the lower parts of the body, like the legs and ankles. This buildup of blood increases pressure within the veins, causing fluid to leak into the surrounding tissues, resulting in swelling. This swelling is a common symptom of heart failure, a condition where the heart cannot pump blood adequately to meet the body's needs. When the heart struggles to control blood flow effectively, fluid starts to accumulate and leak out of the veins, causing swelling. This swelling can be a warning that something might be wrong with the heart. If you notice that your legs or ankles are regularly swollen, especially if the swelling worsens at the end of the day or after standing for long periods, it is important not to ignore this sign. In addition to heart failure, leg swelling can be caused by other issues, such as kidney diseases, liver problems, or varicose veins. However, heart failure is one of the more concerning causes and should be evaluated by a doctor. When consulting a doctor, they can perform tests to determine the cause of the swelling. This might include blood tests, ultrasounds, or even an electrocardiogram to assess heart function. If heart failure is diagnosed, treatment may involve dietary changes, medications to help the heart function better, and, in some cases, medical procedures to correct underlying issues. Taking care of heart health is crucial for preventing and treating leg swelling. By paying attention to these signs and seeking medical advice, you can take proactive steps to protect your heart and ensure it continues to pump blood efficiently, keeping your entire body healthy and functioning well. Remember that leg swelling is not just an aesthetic nuisance. It is an important signal that your body is sending to indicate that something might be wrong. Acting quickly and seeking medical help can help identify the cause of the swelling and take the necessary steps to treat the underlying condition, protecting your long-term health. Did you find this information helpful? If you want to stay informed, don't forget to subscribe and leave a like.